Welcome, and thank you for joining us this morning for our series of conversations on the impact of COVID-19 in Africa. My name is Mary Kay Gugerty, and I'm a faculty member at the Evans School of Public Policy and Governance at the University of Washington, and also an affiliate faculty with the African Studies program at the Jackson School of International Studies, also at the University of Washington. And I also serve as the principal investigator for the International Program in Public Health Leadership. And I'm here today with one of our alumni, Joel Mubiligi, who also is the Executive Director of Partners in Health Rwanda. And we're going to talk today a little bit about how COVID-19 is unfolding in Rwanda, the response of the government in Rwanda, and what the public health sector is doing in response to the pandemic. Due to time considerations, I'm not going to give a longer biography of each one of us, but you can find that on the webpage hosting this site. So Joel, we're so glad to have you with us today, and we really appreciate you taking time at the end of what I'm sure is another very long day in Rwanda working on this issue. So thank you very much for being with us.
You're welcome, Mary. My pleasure.
So I'd like to just start by asking you to tell us a little bit about the progression of COVID-19 in Rwanda to date, and maybe what the situation is like where you are in Kigali and also in the rural areas where I know you've been traveling to work with your hospitals and districts there.
Mm-hmm. Thank you, Mary. The situation in Rwanda is currently stable, if I can define it that way. We had our first case of coronavirus or COVID-19 on 14th of March. And immediately after having the first case in the country, the government have been swift in taking some measures. The following 2 days between 16th and 18th, schools were closed, public gathering, general gathering like churches were forbidden, and only a week after, on 22nd of March, Rwanda was the first country in sub-Saharan Africa to put a national lockdown. That was immediately implemented only a week after having the first case in country. And since then, I think the response and the compliance of the community have been quite good. I think the coordination of the police and the local government in educating the population and directing the population have been very effective, and also mobilization from local communities in the villages with the support of the government in providing food, distributing food to the most vulnerable have been also very effective, and have allowed people actually to be able to stay at home. And so you could see in Kigali, no public transportation, very few cars moving around with passes, and as also the situation have been evolving. Certain other measures have been put in place to facilitate people to move around. Online platform where people could request approval or passes to be able to go to the market or to do different services. So the situation were evolving, and people have been putting, measures to allow some certain vital movement to happen. In villages, the same thing. I think most of the main remaining activity have been markets, which was very difficult to be able to close market because people needed to get some basic needs, but things like bars, schools, community gathering were all forbidden and closed, and very minimal movement really of people. And the result of it is that up to today in Rwanda, we had a total cumulative number of 268 confirmed cases, and with no death, no patient with critical condition, and currently only 138 are still active patients who are at the treatment center. 130 have been confirmed free of the virus with unreadable viral load and were discharged. So there have been really a good result. And coupling with the lockdown, with all these measures, there have been also an important effort from the government to increase capacity for testing. So up to date, we have close to 40,000 of the tests that have been performed, to an average of 1,000 of tests per day that are happening. So and the number of cases have been pretty steady, usually below 10, below 5 on every day. The highest peak that we had was 22 in a day. And interesting, that happened last week with the resurge of cases in the eastern of Rwanda, in the border with Tanzania, with mainly the majority being truck drivers who have been coming from Tanzania to Rwanda because we did not stop trade of essential goods like food and so forth. So that's in brief the situation, the way it has been evolving. Until Monday, we have the ease of the lockdown situation, and we are having now some circulation happening, people going around in the road, but the government have been allowing some companies or manufacturers to produce masks, and we are seeing more and more people using masks, which is becoming mandatory now, but still major gathering like school and churches are still closed.
And I'm curious, when I think about the government's response and the public health system's response in Rwanda, I know there were a lot of lessons learned from the Ebola outbreak earlier, and a lot of measures that were put in place from that. Can you talk a little bit about how responding to Ebola helped kind of prepare the public health system and the government for responding to this pandemic?
Oh, yes, definitely. I think, Ebola just came after a period of close to 3 years that we have been going on with Ebola cases in a neighboring country of Congo, really close to the border in the eastern part of Congo, so really close to Rwanda. And, for 3 years, Rwanda have been very in alert, putting in place screening teams, response teams at the borders, at each hospitals, training across the country of response teams in the usage of PPEs, supplying some quantities of PPEs, setting up isolation centers. So there have been some basics, though, the spread of coronavirus is nothing compared to Ebola. So whatever we're prepared with an estimation of how much can be cases of Ebola, which is nothing compared with coronavirus. So we had to build from that and expand and train more people. So the people were trained became trainers of others within the facilities where they work. So there have definitely been a base for us to start on, and actually a sense of vigilance and coordination that was already there.
Interesting. Yeah. And it kind of goes back to the point you were making earlier about transmission coming in the eastern part of the country through truck drivers from Tanzania. So I wanted to ask a little bit more about how the country is thinking about that, given that you're a small, landlocked, or at least with a lake on one side that's part of the border with Congo, how you guys are thinking about sort of the medium and the long term of this, if other countries aren't responding in the same way that Rwanda is. How will you think about the situation for the next few months or the rest of the year?
Yeah. I mean, that's a tough question, and if there's anything that the situation is in coronavirus is teaching us, is really to be nimble and reacting and adjusting a situation is evolving with a lot of uncertainty, really a lot of uncertainty. So whatever is happening in Rwanda, whatever is happening in neighboring country, and whatever is happening in the globe, I think we need to have a sense, and that's the responsibility at each country, that we need to have a sense that our responsibility is not only for the people within our own country, but it's global. Because if one country is doing a good work where a neighbor is not doing a good work, it will have an impact anyway. So that's the situation. The most concerning part, as you said, Rwanda being a landlocked country, we need the trades, we need the movement for our survival. So definitely expecting a high impact on our economy. But I think the same thing that that pushed the decision of the government from the beginning to take strict measures, strict public health measures, it was really by the logic that economy itself is not a worthwhile reason for not taking the correct public health measures. So we're going really through that mindset, and we'll see how the situation evolves.
Yeah. Great. Yeah, it's a challenge for all of us. And I love your point about how it really is a global problem and we need a global coordinated solution.
Yeah.
Here in the States, we've been talking a lot about how the coronavirus and the response to it has really amplified and exposed many of the social and health inequities in our own country and some of the challenges that marginalized communities face every day. And I know you spend a lot of time thinking about equity. You're a faculty member and on the board of the University of Global Health Equity there in Rwanda. Based on your experience, how do you think this is shedding light on how policies and public health systems in general need to really think about health equity as a fundamental concern?
Mm-hmm. That's a very good question. I think coronavirus has revealed clearly now in the eye of everyone, when you read papers, when you hear news, it's clear that it's clear that how deadly a poor health system and a weak public health leadership can be. And a public health leadership that's really not focused into equity can be. On the other hand, it has also revealed the efficiency of a robust public health system. It has also revealed the efficiency of equity-centered leadership. So when you are seeing country by country, you definitely see the gaps. And I think that's actually where everything started. The virus started in a corner of a market in Wuhan and spread, becoming a pandemic, really using breaches within public health system of every country, being a lack of diagnostic capacity, being rationed health services for certain people and not other, being, you can name them, inadequate public health measures. So the virus really used that to really expand and become a pandemic. And I think, that's really my thought. I think it may probably stay if we don't stop blaming and competing each other and and putting on a little bit our equity lens and act with a more scientific humility, solidarity, and coordination. To me, that's really the thing that need to happen between the scientific community, between countries, and think of it not only right now, but for the long term. Everyone have been telling how there have been people who have been predicting such a pandemic would happen at the point or not, but it seemed like no one was listening. And from history, know that we also have a very short memory. But I hope this one will not allow ourselves to have a very short memory and really be able to think in the long term and build more equitable systems.
Yeah, thank you. Yeah, you sort of addressed my last question, which was just really how can this pandemic open the door to new solutions or new ways of thinking about addressing these public health disparities and really seeing them as fundamental social disparities. So I appreciate that. I want to ask you, as you know, I was there in Rwanda in early March, just before this all broke out and we had a chance to be together. So in my mind, I've really been envisioning and looking at pictures online about what's been happening in Rwanda, since it's so close to my recent experience. And I wonder, before we go, if you could tell us a story or just give us an example of something you've seen over the last 45 days of lockdown or whatever it is, that's just really made you appreciative of the country, or just an example of sort of Rwandans coming together, or the public health system coming together, things that have touched you as you've gone through this experience.
I mean, there's definitely a lot to say. I think the thing that I mentioned, really the effort and the commitment of the government to make sure that as we're putting measures of lockdown, we come as a community and with the leadership of the government to really take care of those who are the most vulnerable and those who are the most touched by this situation. That would have been something very, very appreciated. But on the other hand, I think something really personal as an example, when we talked about, on the previous question, when I talked about how now with coronavirus, we're going to really think about equity in terms of policy and so forth. I think to me, it all starts, when we're discussing strategy, when we're discussing policies, the point needs to start from the idea on the understanding that health is a human right, and usually we get stuck by the costs and the difficulties that implication implies. But I mean, if we start with that, there is no way to really progress. But if the starting point is, okay, this is a human right, let's find a way to solve this, then I'm pretty sure that nothing will could stop human ingenuity to find solution around it. And I saw the experience here now with the lockdown. We have a program here in Rwanda that take care of cancer patients, and in a hospital that is in the northern part of Rwanda. And we serve patients coming from all over the country. And we serve also patients even coming from the region. So you can imagine this lockdown period, what was that for our patients? For patients who needed to come to the facility to take their biweekly chemotherapy or getting their monthly chemotherapy and so forth. So the way we really mobilized with other facilities here in Rwanda, the Rwanda Military Hospital, the district hospitals, to find solutions for those patients, to make sure that they actually get access to the care, shifting teams from the hospital in the northern, bringing them to Kigali, splitting two teams in two different sites, and allowing them to take care of the patients, having our cars moving around the country to pick patients from their places, bring them to facilities for treatment, and bring them back home. You have call a partner and say, listen, I need to bring this patient across the country. I don't have a car. They'll say, okay, take 3 of my cars, use it. We had a call with Zipline. Zipline is another NGO here in Rwanda that he used to fly to distribute blood through drones at health facilities and discuss with them, please, can you help us distribute this oral chemotherapy to our patients close to their places? The following 2 days, we had our first patient receiving treatment from drones. So that's really when I'm talking about human ingenuity. And I think, when you start really with that idea of health as a human right, it really opens up possibilities. And I think now, because of the situation, everyone was prone to understand that. Everyone could see the impact of the patient, and everyone was very responsive. And we have been seeing a solution to me, it has been a very encouraging experience in my journey in global health, and I really strengthening that belief.
Great, thank you, and thank you for that story. We really appreciate you spending some time with us today. This is the end of our Kigali to Seattle conversation, but I really appreciate that you've given us a lot to think about, and a lot that I think our own country can think about and learn from the experience and the response of Rwanda. So thanks so much for being with us, Joel.
Thank you very much, Miriam. Thank you for having me.